Hello, I'm Dr. Valerie Walker, and welcome to another exciting moment of the medical moment. Today, we're going to be talking about neuropathy. You hear a lot of people today say, my doctor told me I had neuropathy because I have burning and aching and itching in my feet and I can't feel my feet. What exactly is neuropathy? So you got to stay with me on this because I'm going to take you through the anatomy, but I'm going to make it real simple so you will understand neuropathy. First of all, let's just break down the nervous system. Neuro means nerve, and pathy means pathology, or you got a sick nerve. So when the doctor tells you you have a neuropathy, you have a nerve somewhere that's in trouble. Did you know that the human body has 7 trillion? I didn't say million, I said billion, I said 7 trillion individual nerves in the human body, all that arise outside of the brain and the spinal cord. And the reason why I have the brain sitting here, and you can take a look at it, and have you noticed this brain is shaped just like a walnut? Guess what the nut that's most important and most nutrition for brain health? A walnut, and the brain is shaped like a walnut. Well, let's split it up today into 2 parts. The brain and the spinal cord, and we call that the central nervous system, and then the peripheral nervous system, which are all those other 7 trillion nerves that are out there. So for our discussion today, though, we're going to talk about peripheral neuropathy, are those other nerves outside, remember, of the brain and the spinal cord. So this is the brain, and real quick, the spinal cord, it starts usually about in the nape of your neck, and if you're from the country, you remember the old folks used to call it your kitchen when they used to have to straighten your hair, and it was nappy back there. They said, oh, I got to get that kitchen. So it starts right at the nape of your neck, and usually goes all the way down to about the top of your butt, and that's the spinal cord. All of these 7 trillion nerves originate out of the brain and the spinal cord, and that's going to be our discussion today. So when somebody tell you, you done got on my last nerve, that's over 7 trillion nerves you done got on. So you have really rubbed them the wrong way. So let's just talk about, first of all, let me give you the 3 types of nerves of those 7 trillion. And it spells the word SAM. So if you got a little pen and pencil somewhere, just write it down. Just write down SAM. Actually, the word SAM, and I'm not talking about Sam's Club, so don't y'all shoot out and go shopping. I'm talking about the types of nerves are actually named by SAM. And S will stand for sensory nerves. And remember that because that's going to come up a little later in the show. A is autonomic, and that's the automatic nerves in the body, the ones that you cannot control, like you can't tell your heart beat right now. And the heart beats right now. I tell your intestines, I want to go to the bathroom right now. And you go. Those are the autonomic nerves that stimulate the gut and the heart and different parts of the body that you have no control over. And motor, and that stands for the M. So SAM are the 3 types of those 7 trillion nerves that we're going to talk about. So what are the functions of nerves? What do they do? Well, because the brain is just a big, huge computer in your head that controls everything, the nerves control every facet of the human body. You can't make a move unless those nerves innovate something else to make a move. So the nerves are very, very important. And one of the first things they're responsible for is your sensory input, your smell, your sight, your optic nerve, you can see, and all those are sensory things that you sense every day. Well, that part of the nerve is responsible for that. Then you have the motor nerve in charge of your motor and your function and all. And then again, the A stands for autonomic, meaning automatic, those nerves in the body that does things and perform their job, but you can't control it. But you can control the motor and sensory aspect of your nerves. So far, stay with me. Just remember, 7 trillion nerves, they all got different functions and different things they do. And actually, when they get disease and you have problems with them, it really going to depend on the type of nerve, where it's located, and what its function. That's where the symptoms are going to come from. And that's why the symptoms, when you have nerve damage, and remember, I told you neuropathy means the nerve is sick, something that's happened to it. It's going to depend on what part of the body it supplies, how big it is, how many nerves are involved, and that will determine our treatment, which we're going to talk about just a little later in the show. So when people say, I'm about to have a nervous breakdown. There again, that's a lot of nerves to break down. When they said my nerves are short, some kind they can short circuit, so that can be true too. And when they say I am just a bundle of nerves, that also can be true because people can in fact be a bundle of nerves. Okay, so we know that we got the 7. I'm going to keep saying that just so you will just grip the magnitude of what nerves do and how many you have. You have that 7 trillion, and when they go wrong and things get wrong with them and they get sick, the first thing you can notice is impaired sensations, like in your feet. And let's just take the diabetic foot pencil, because that's one of the biggest ones that we talk about all the time. You can start feeling numbness. You can start feeling tingling. I have patients tell me sometimes that their foot actually itch. They say they get an itch in their feet, and they said, Dr. Walker, it's just an itch so severe, even when I try to scratch it, I can't get to it. It's just like a deep, deep itch in my foot. And then you can have problems with your coordination. Remember I told you the motor, the SAM, the M stands for motor. Sometimes your gait is off, meaning you may be walking to one side and all, and you cannot straighten yourself up. Or if it impairs the autonomic system, especially in diabetics, you can have problems with your bowels and all the organs and the glands that the nerves control. That's where you will see the problem. So if you're having a problem with the nerves that's feeding into your GI tract, your gastrointestinal tract, then that means you're going to have problems related to your gastrointestinal tract. That's why you got to just remember for this presentation, it depends on the nerve, because you got a lot of them. It depends on the location. It depends on if it's one nerve involved. Remember we did the story on Justin Bieber, Ramsey syndrome, when he had that facial paralysis. Remember he had that one nerve involved, the facial nerve. And that's called a mononeuropathy, meaning one. Well, sometimes you can have many nerves involved, and we call that a polyneuropathy. So, and then you can have nerves involved in different parts of the body. Like a nerve is bad over here, and another one is bad on the right, another one is bad on the left. So because you have so many nerves, you got to always try to get to one, the cause of what's having the problem, and two, how in the world can we fix it when you have so many nerves in the human body. Okay, now let's just go through 2 things that can happen in what we call peripheral neuropathy. Because remember again, and I'm going to keep saying this so you'll get it, the central nervous system, the brain and the spinal cord, then the 7 trillion are all the rest of we're talking about. Well, when an injury occurs to the nerve, it can go in 2 phases. It can be acute, meaning you wake up and just something is very, very horribly wrong, like a Bell's palsy or anything where the face is drooped and you went to bed just fine and you woke up and you had this problem. Or it could be chronic in diseases like diabetes where the nerves are being damaged for years. Actually, research shows that symptoms of diabetes show up 12 years before we even diagnose it. Isn't that something? So we got to come up with ways to attack this disease, because it's really horrible, and get to it before it starts doing all the damage it can do, because then we separate it from acute, meaning that it just happened, to chronic, where it happens suddenly. It's just sneaky, just like Satan. He's sneaky. So it just kind of sneaks up on you, and one day you wake up and go, I don't feel my feet, I don't feel my hands. It wasn't nothing you just woke up one morning and jumped out the bed and couldn't hardly walk because you couldn't feel it. This is what we call gradual onset, and a lot of times that's the most difficult to treat. You know why? Because it's been going on for so long, undetected, and we not knowing anything about it. So acute and chronic, those are the type of neuropathies that we see most often. What causes them? So how does the nerve get sick? And remember I told you that neuro means nerve, and pathy means disease or illness. So let's just, to make it simple, say your nerve is sick. Just like you can get sick with a cold or sick with anything else, in neuropathy, the nerve itself can get sick. Well, number 1 on our list, like I told you earlier, is diabetes. We're seeing a lot of diabetes in this country now. You know why? Everything got sugar in it. I don't care what it is. Did you know that bratwurst you eating at the barbecue and you going, oh, what's for dessert? And all, well, the bratwurst is for dessert. You know why? A lot of them, and that's why you really got to always read labels. Did you know they put sugar in bratwurst? And I remember growing up in the country, and most of you know I'm a country girl. When my granddaddy nose had hog killing day, when they killed a hog, never did I see a big bag of sugar that they dumped over that meat when they were making sausage. They just didn't do it. The food was just more natural. It tastes better. And my grandmother could go in that kitchen and cook some grits and cook some of that fresh sausage. And oh my goodness, would it be good. So you've always got to pay attention to what you eat. The problem in America is this. Everything got sugar in it. I don't care what it is. So your doctor tell you, I need you to eat more vegetables, and I need you to eat more salad. So you go home and you make you a big old nice salad, beautiful salad, just fit for a king or a queen, and all of a sudden you pull out your salad dressing, and guess what? The first ingredient on this salad dressing, you know what it is? Sugar. So you've just killed off the whole process. You got that big, beautiful salad, and you dumping it and you drowning it in sugar. So who would ever think, nice salad dressing for my nice salad, and it's drenched in sugar. So diabetes is prevalent in this country. It's getting worse. We seeing it young people as old as 12 years old with the type 1, getting you when you're juvenile and born without a lot of insulin, to type 2, which is we used to call, like I said, old folks insulin. Well, guess what? All the young people got the old folks diabetes because everything you're eating, mostly, unless you're paying attention to that label and unless you're out there growing it yourself, guess what? It has sugar in it. So everything has sugar in it. Chicken noodle soup has sugar in it. So it's just our Western diet is just full of sugar, and we wonder why every second we diagnosing somebody with diabetes, which is a horrible, horrible state. They think now, research-wise, that diabetes just may be a combination of all kind of diseases going on at one time in your body because the sugar damages so many parts of the body. And that's why diabetics I had a diabetic patient one time stuck a nail in his foot. He did not know that nail was there for months. And by the time he came in to get it checked out, the nail had been there so long, he was almost due for an amputation. That's how bad it had got. So all you diabetics out there, and we'll talk about that a little bit in treatment, make sure you check your feet on a regular basis. Just always make sure, because you may not feel anything. A lot of things with diabetes too with the heart is that diabetics have what we call silent heart attacks. They can have a heart attack and not even feel it, and that's the same reason they don't feel anything in their feet. They don't feel anything in the heart either. So a lot of times when I do an EKG on a patient who's diabetic, and I said, did you know you've had a heart attack? And they go, no, I never remember having a heart attack. I remember one morning waking up with a little gas or something, and I stayed in bed all day, and I thought that was it. I said, that was probably that heart attack then. So diabetics are prone to silent heart attacks. So if you're diabetic, please keep up with your A1Cs, keep up with your cholesterol, your blood pressure, and make sure you check your body. Just run your hands over it and check everything, because a lot of times those nerves are so damaged that it damages the way they make you feel, and you can't feel a whole lot. So diabetes, let's pay attention to it. It's a very serious illness. Then leprosy. Leprosy is mentioned in the Bible. Remember the guy with the leprosy in the Bible? And this is caused by a bacterial infection, a long-term bacterial infection, and we call it Hansen's disease. But guess what? It can give you a neuropathy. So way back in biblical days, they suffered with neuropathy. It was not a common problem. Vitamin D deficiencies. Always keep up with your vitamin levels and talk to your primary doctor. Always, everything you hear on this show, I want you to go back and talk to your doctor about it and make sure that you're doing the right things, because guess what? Everything in life is balanced. You could have too much of something going on, and you could have too little. Like you may be vitamin B deficient, but you may have too much vitamin B6, which guess what? Can cause a neuropathy. So always be in balance with your vitamins and always share all your concerns and all with your doctor, and make sure you write down things before you go to the doctor, but so you don't be in there going, I forgot what I was going to ask you. Then 5 minutes later, you calling me on the telephone going, oh, Dr. Walker, I found my list of 20 things that I want to talk to you about. And I'm saying, no, you should have hit me with those 20 when you were in here. So write it down and take it to your doctor. And always remember, always in life, you want to fall kind of in that neutral zone. You don't want to go too far to the right. You don't want to go too far to the left. And that's the same thing when you do vitamins. You can do too many. Oh, yeah, you can do so many vitamins that you can damage yourself. Too many vitamins could actually damage your liver. So you want to always be in sync and do it right. Other thing is chemotherapy, and most of my cancer survivors out there, they can attest to the fact that chemo can damage some of those 7 trillion nerves that we have in our body, and then they can start having some of those same symptoms of numbness, tingling, muscle cramps, cramps in your legs, all the things like I told you before. It depends on which nerve is damaged and where is it located. You know, you could damage the nerve in your eye, the optic nerve in your eye, and get a neuritis in your eye. So just wherever that nerve is located in the back of your mind, say to yourself, where is this nerve located and what damage is it doing to that part of the body? So that's what you want to pay attention to, and that's VAS. Alcohol. All right, let's talk about alcohol. Number one, as Americans, we drink it more than ever, especially since COVID. And I guess a lot of it had to do with you being pinned in for the first time. This has never happened in American history, but alcohol abuse syndrome is at an all-time high. So let me just go and bust your bubble right now and kill off your parade. You should have only ladies 1 drink a day, if that, and men no more than 2. Now, I know all of y'all want to polish off a little bottle of wine at dinner time. No, 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 no. 1 glass for the ladies and 2 for the men, and you are done. And hopefully you'll start eating your nice salad and some good vegetables and some lean meat, okay? The other thing that can damage those 7 trillion nerves is radiation. If you've had to have chemotherapy followed up with radiation, or just radiation for a problem that you're having, these can damage those blood vessels too. So you can get a neuropathy, those same type of symptoms that we've talked about earlier also. Other things is medications. We can implicate medications in most things. Most medicines are safe. Most medicines are good for you if you need them, but a lot of times medicines can hurt you, and they're actually a class of antibiotics that can hurt the human body and give you a neuropathy. These are called fluoroquinolones. They can do it too, like Cipro and all these drugs. They can, in the long term, not usually short term, give you a neuropathy. Flagyl, and most ladies have heard of Flagyl before, is associated with a neuropathy. So there again, there are a lot of things that can give you neuropathy. We can't leave out viruses. We can implement viruses in everything, like COVID-19 is a virus. Stephen King wrote this novel years and years ago about called The Stand. It was so scary, I could not finish it. And it was about a virus. I turned on every light in the house for months. That's how spooky this thing was. But it's about viruses and how they kind of took over. Problems with your immune system can trigger a neuropathy. Celiac disease. And that's why a lot of times you have to be gluten-free, and you talk to your doctor about that. And the last 2 is genetic. Did you know neuropathies can run in families? And like I say in my best-selling book, you can never run away from your DNA. And the last and probably one of the most important is what we call idiopathic neuropathy, meaning no known cause, meaning people can get a neuropathy We run every test in the world. We do all we can do to find out what exactly happened with you, and we never come up with an answer. And that's a lot of times true with a lot of things that happen with people in healthcare today. We do all the tests. We run every test we can think of. We talk to family members, and we cannot come up with the reason. So in conclusion, always remember, we're talking about those peripheral nerves outside of the brain and the spinal cord. There's 7 trillion of them, depending on the location of these nerves, depending on the damage that they can do, and that they can do damage. We broke this up into 2 sessions because this is a lot, and I don't want you to not get the concept of what's going on with neuropathy. And when we come back, we're going to talk about how in the world do we diagnose it, and better still, how do we treat it to get these symptoms better? Because in a lot of people, they are actually debilitating and very, very bad. This is Dr. Valerie Walker with just part 1 of neuropathy. We'll be right back with part 2.